Welcome back to KTN Prime. Thanks for staying with us. Let's take a look at the latest updates on the ongoing industrial action by healthcare workers. And at least 3 counties have initiated disciplinary action against their striking health workers, with some replacing the protesting workers in efforts to bridge the human resource gap left by the ongoing strike. This follows a directive by the Council of Governors last week during their State of Devolution address, asking the county service boards to take action against any worker who absconds duty. Gloria Milimu reports.
As the health workers' strike persists over push for better terms of service, several counties have begun replacing their striking staff in a move they say seeks to bridge the glaring human resource gap. 3 counties, Mombasa, Murang'a and Nyandarua, are said to have initiated the process. For the striking nurses who are part of the cadres currently engaging their employer in an industrial dispute for the 15th day running, their resumption to work, they insist, will only be affected by implementation of their 2017 collective bargaining agreement. The nurses staged demonstrations in Nairobi on Thursday.
If at all nursing is essential service in health sector, then the demands and the rights of nurses are also essential and important.
We have been patient enough. The courts will not be used to intimidate us for us to go back to work.
The health workers, whose procession began at the Green Park bus terminal before proceeding to the Council of Governors headquarters, have faulted COG for derailing the implementation of the crucial document whose contents were signed and agreed upon in 2017.
What is this that COG cannot give nurses what they want so that they can go back to work?
During their State of Devolution address, the COG told county service boards to initiate disciplinary action against their striking workers as their strike had been declared illegal by a Mombasa court.
If some healthcare worker in a particular county decides, in spite of all that, they're not coming to work, it just means they don't want to work.
COG had also said that it needed to match the funding model with the kind of contracts UHC health workers were pushing for. As the strike persists, critical services in public facilities across the country continue to suffer as the striking workers and their employers maintain their hardline position on resolving the impasse. Gloria Milimu, KTN.